Good afternoon. Dr. Onwah Ogheneuzuazo. I'm presenting an abstract on prevalence and predictors of persistent low-level viremia among persons receiving Dolutegravir-based antiretroviral therapy in southern Nigeria. And so one of the goals of ART, antiretroviral therapy, is to halt viral replication and rapidly reduce viremia to undetectable levels. And so persistent low-level viremia is a risk factor for virologic failure. With the scale-up of or introduction of the Dolutegravir for ART, we've accelerated progress towards achieving the UNAIDS TED95. But not much has been documented about persistent low-level viremia in persons receiving DTG for ART. And it's important to look at because persistent low-level viremia poses a risk to HIV epidemic control, threatens HIV epidemic control, but doesn't necessarily affect achievement of the TED95. And so what did we do? We looked at persons receiving ART in 154 healthcare facilities in southern Nigeria that receive support from PEPFAR through USAID. In those facilities, persons with low-level viremia, which is defined as viral load between 51 and 999 copies per mil, receive additional adherence support. And then we measure their viral loads at 6-month intervals. And so what do we find? We included 140,000 persons living with HIV in this study, and 2/3 of them were female, and the median age was 37 years, median duration on ART was 2 years, and about 90% of them were receiving ART through differentiated service delivery models. What we found was that 10% of these clients had low-level viremia at the first measure, and then at the second measure, 0.6% progressed to persistent low-level viremia. 9.7% achieved undetectable viral load, and just 1/10% progressed to virologic failure. Persistent low-level viremia did not discriminate by age and sex, but was associated with increasing duration on ART and not being on any differentiated service delivery model. What this means is that if we continue to look at epidemic control measured by the UNAIDS TED95 as a target, with a benchmark of less than 1,000 copies per mil for viral suppression, and if we continue to make recommendations for additional adherence support and frequent viral load monitoring based on that benchmark, we potentially miss out on a lot of people who would benefit from these services and might take away from the progress we've made so far in HIV epidemic control. Thank you.